Before we dive in, please remember that this video is for informational and educational purposes only. The career information, including salary ranges and job descriptions, is based on publicly available data and our research as of the time of this presentation. It is not financial or career advice. You should always conduct your own thorough research and consult with professional career advisors before making any decisions. Imagine for a second you're a doctor in a busy emergency room. A patient is wheeled in unconscious and you have minutes, maybe seconds, to make a life or death decision. You pull up their medical history on a screen, but it's a disaster, a chaotic digital puzzle. Their primary care records are in one system. Their critical allergy information is locked in another. A recent lab result from a specialist is buried in a PDF attachment, basically a ghost in the machine. You have to make a call right now with only half the picture. What if the one piece of data you can't see, that one allergy, that one recent medication change, is the key to saving their life? This isn't a scene from a TV show. This exact scenario, in thousands of different forms, plays out every single day in hospitals and clinics all across the United States. It's a quiet crisis, a multi-trillion-dollar problem built on a foundation of fragmented, messy, and often inaccessible data. It leads to medical errors, which are one of the leading causes of death in this country. It leads to physician burnout, and it's costing us all a fortune in redundant tests and inefficient care. But what if I told you there's a new breed of professional emerging from the shadows to fix this? A group of digital detectives, data architects, and tech translators who are building the future of medicine, one smart system and one line of code at a time. They operate at the thrilling intersection of healthcare, technology, and data. They are the unsung heroes of a field called Health Informatics. And in this video, we are not just going to tell you about this field. We are going to give you the exact roadmap to join it. We are breaking down the top 5 most in-demand, highest paying, and highest impact career paths in health informatics in the United States right now. We'll cover the salaries you can expect, the skills you actually need to get hired, and how you can break into this explosive field. Even if you have zero background in medicine or technology today, if you're looking for a career that offers incredible job security, a 6-figure salary, and the chance to genuinely save lives and solve one of the biggest challenges of our time, then you are in the right place. So why is this happening right now? Why is health informatics suddenly one of the hottest career fields in America? It's because we've hit a tipping point. For years, the US healthcare system ran on paper, on manila folders and fax machines. Then a massive government push forced nearly every hospital and clinic to go digital, to adopt electronic health records or EHRs. This created a data tsunami. Think about it. Every doctor's note, every prescription, every lab result, every heartbeat monitored, every single thing that happens to a patient now creates a digital footprint. Add to that the data streaming in from our smartphones, from our Apple Watches and Fitbits, from at-home genetic tests. We are generating more health data in a single day than we did in an entire year just a decade ago. The problem is, most of it is just noise. It's a chaotic digital landfill. Health informatics is the science of turning that landfill into a library. It's about creating systems that allow that ER doctor to see a patient's complete, unified story in a single glance. It's about building algorithms that can predict a sepsis infection hours before a human doctor can spot the signs. It's about designing patient-facing apps that help a diabetic manage their insulin from the comfort of their home. It's where technology stops being a burden and starts becoming a cure. Now, before we get to our top 5 list, let's bust a couple of huge myths about this field. Myth number 1. You have to be a doctor or a hardcore coder to get a job. This is completely false. Health informatics is a team sport. It needs people from all backgrounds. Yes, it needs doctors and nurses who understand the clinical side. We call them clinical informaticists. Yes, it needs software developers and data scientists who can build the technology. But it also desperately needs project managers, business analysts, security experts, and user experience designers who can bridge the gap between the two worlds. Some of the most successful people in this field were English majors or teachers, or worked in finance before they made the switch. The number 1 skill is not coding. It's problem solving. Myth number 2. It's a boring desk job just staring at spreadsheets. If you think building a system that alerts a pharmacist to a potentially fatal drug interaction is boring, then this isn't for you. If you think designing a telehealth platform that connects a rural patient with a top specialist 1,000 miles away is boring, look elsewhere. This isn't about spreadsheets. It's about building digital lifelines. It's an active, collaborative job where you spend your time talking to users, understanding their challenges, and building solutions that have a direct, tangible impact on people's well-being. So, how do you find your place in this revolution? To make it simple, we've analyzed hundreds of job titles and career paths and boiled them down into 5 core roles. These are the positions with the highest demand, the best salaries, and the biggest potential for growth over the next decade. For each one, we'll break down what they do, how much they make, and how you can become one. Let's dive right into our number 5 career path, a role that is arguably the most critical foundation for the entire field, the Clinical Informatics Analyst. So what on earth is a Clinical Informatics Analyst? Think of them as the ultimate translator. They are the bridge between the medical staff, the doctors, nurses, and pharmacists who are on the front lines, and the IT department who builds and manages the technology. They speak both languages fluently, medicine and tech. Here's what a day in their life might look like. In the morning, you might be shadowing a surgeon in the operating room not to watch the surgery, but to watch how they interact with the computer system. You're looking for pain points. Does it take them 7 clicks to order a blood test when it should only take 2? Is the system layout confusing, causing them to miss critical alerts? You're an efficiency detective, hunting for ways to make the technology faster, safer, and more intuitive. Then, in the afternoon, you're in a meeting with the software development team. You take your real-world observations from the OR and translate them into technical requirements. You'd say, the surgeons need a one-click button on the main screen for ordering post-op labs. Here's what it should look like, and here's the data it needs to pull. You're the voice of the user, ensuring that the tech being built will actually solve real-world problems and not just create new ones. These analysts are absolutely essential. Hospitals in the US spend billions of dollars on sophisticated EHR systems from companies like Epic, Cerner, and Meditech. But without a great clinical informatics analyst, that expensive software is just a glorified, frustrating typewriter. It causes clinician burnout and can even lead to dangerous workarounds. The analyst is the one who customizes, configures, and optimizes that software to fit the unique workflow of their hospital, making sure the technology actually helps instead of hinders patient care. So let's talk about the numbers. What's the salary and demand like? It's fantastic. According to the latest data from industry surveys and job boards, the median salary for a clinical informatics analyst in the United States is hovering right around $95,000 a year. For those with a few years of experience or a specialization in a high-demand system like Epic, clearing $120,000, even $140,000 is very common. And the demand is relentless. The Bureau of Labor Statistics projects that jobs for health information technologists and medical registrars will grow much faster than the average for all occupations. Every hospital, every large clinic, every health system needs a team of these people. So how do you become one? This is one of the most accessible roles for people looking to break into the field. The most common pathway is for people already in a clinical role, like a registered nurse. A nurse who is tech-savvy and a good problem solver is the perfect candidate. They already understand the clinical workflows inside and out. But you do not have to be a clinician. We see people transition from roles like business analyst, IT help desk, or project manager from completely different industries. The key is to build a foundation of core skills: an understanding of medical terminology and clinical workflows, strong communication and analytical skills, and increasingly, familiarity with a major EHR system. Getting a certification in a system like Epic can be a golden ticket to your first job. Getting a certification in a system like Epic can be a golden ticket to your first job. And that golden ticket can lead to some serious gold. Let's talk numbers. An entry-level EHR specialist, maybe someone with a healthcare background and a fresh certification, can expect to start in the range of $60,000 to $75,000 a year. Now, that's a solid starting point, especially if you're transitioning from a clinical role with a lower pay ceiling. But here's where it gets exciting. With 2 to 5 years of experience, as you become the go-to person for a specific module or workflow, you're looking at a jump into the $80,000 to $95,000 range. Senior EHR specialists, the ones who lead implementation projects or manage a team, can easily clear 6 figures, often landing between $100,000 and $120,000, and sometimes even more in high cost of living areas or at major hospital systems. The career ladder is also incredibly well defined. You don't just get stuck fixing login issues for 10 years. You start as a specialist, you master your craft, and then you have options. You can climb vertically, becoming a senior specialist, then an EHR team lead, and eventually an EHR manager or even the director of clinical applications for an entire health system. Or you can move laterally. Your intimate knowledge of the EHR system makes you a prime candidate for roles like a Clinical Informatics Analyst, a Health IT Project Manager, or a consultant for a firm that helps hospitals implement these massive systems. That HR specialist job isn't just a job, it's a launchpad. So what does a day in the life actually look like? Picture this. You arrive at work, grab your coffee, and your first task isn't about patients, it's about the system that cares for them. There's a ticket in the queue. A physician in the cardiology department is getting an error message when trying to order a specific medication. It's a puzzle. You dive into the system's backend, tracing the workflow logic. Is it a user permission issue? A glitch in the latest software update? A problem with the drug formulary database? You collaborate with the pharmacy informatics team, run a few tests in the development environment, and pinpoint the issue. You push the fix, notify the physician, and close the ticket. That's one small fire put out. A tiny action that ensures a patient gets the right medication on time. The rest of your day is a mix. You might spend an hour leading a training session for new nurses, showing them how to efficiently document patient care. Then, you're pulled into a meeting with the oncology department to discuss building a new custom report they need for a cancer research study. You're the translator, turning their clinical needs into technical specifications. In the afternoon, you might be testing new features for an upcoming system-wide upgrade, trying to break the software so that it doesn't break when it's live and impacting thousands of patients. It's a blend of technical problem-solving, teaching, and project management. Now, it's not all rainbows and six-figure salaries. The biggest pro is the high demand. Hospitals are always implementing, upgrading, or optimizing their EHRs, so your skills are incredibly valuable. You're also making a tangible impact on healthcare without being on the front lines of patient care, which appeals to a lot of people. But the cons? It can be a high-stress environment. When the system goes down during peak clinic hours, all eyes are on you. The pressure is immense. It also requires a commitment to lifelong learning. Technology in this space changes at lightning speed. And sometimes you can feel like a glorified IT help desk, stuck between frustrated clinicians and the rigid limitations of the software. But for the right person, the puzzle solver, the helper, the tech-savvy translator, it is an incredibly rewarding and stable career. But what if you're less interested in the day-to-day nuts and bolts of one system, and more fascinated by the giant sprawling story that all that data tells? What if you want to be the detective who sifts through millions of data points to find the hidden patterns that could predict the next flu outbreak, or identify which treatments are actually working? That's where you move from managing the system to mastering the data within it. And that brings us to our number 4 career path, the Health Data Analyst. If the EHR specialist is the mechanic keeping the engine of healthcare data running, the Health Data Analyst is the performance engineer, figuring out how to make the entire car go faster, safer, and more efficiently. These are the storytellers and the fortune tellers of modern medicine. They take the chaotic flood of information generated every single second in a hospital lab results, patient demographics, billing codes, clinical notes, and they turn it into clean, actionable intelligence. Think about it. A hospital wants to know why their patient readmission rates for heart failure are higher than the national average. A simple question, but a massively complex answer buried in the data. The Health Data Analyst is the one who gets that question. They don't just pull a report. They start by querying massive databases using languages like SQL, pulling together disparate datasets from different systems. They clean the data because healthcare data is notoriously messy. Then they start digging. They analyze the demographics. Are the patients from a specific zip code? Do they share a common comorbidity? They look at the treatment protocols. Were they all prescribed the same medication? They look at discharge information. Were they discharged on a Friday afternoon with less follow-up support? Using tools like Python or R for statistical analysis and platforms like Tableau or Power BI to create visual dashboards, they start to see a story emerge. They discover a correlation. Patients discharged on Fridays have a 15% higher chance of being readmitted within 30 days. They build a dashboard that visualizes this trend, presenting their findings not as a spreadsheet of a million rows, but as a clear, compelling chart. They present this to hospital leadership. Because of their analysis, the hospital implements a new policy for weekend discharge planning and follow-up nurse calls. 6 months later, readmission rates drop by 10%. That's the power of a health data analyst. They didn't treat a single patient, but they improved the outcome for hundreds. So, what does it take to become this kind of data detective? The skill set is a unique blend of technical prowess and healthcare knowledge. First and foremost, you absolutely must know SQL or structured query language. This is the language you use to talk to databases. It is non-negotiable. If you want to be a health data analyst, you start with SQL. Period. Next, you'll need proficiency in at least one statistical programming language, with Python and R being the two industry giants. This is for the heavy-duty statistical modeling and machine learning. You also need to be a master of data visualization. It's not enough to find the answer, you have to be able to communicate it effectively to people who are not data experts like doctors and executives. This is where tools like Tableau and Power BI come in. You're not just making charts. You're building interactive dashboards that allow leaders to explore the data for themselves. And critically, you need a foundational understanding of healthcare itself. You need to know what CPT and ICD-10 codes are. You need to understand the difference between an inpatient and an outpatient setting. You need to be familiar with data privacy laws like HIPAA. Without this context, you're just a technician playing with numbers. With it, you're a valuable strategic partner. The pathway to becoming a health data analyst can be more varied than for an EHR specialist. Many come from a technical background with degrees in computer science, statistics, or information systems, and then learn the healthcare side. Others come from a clinical or public health background, and then aggressively build up their technical skills through boot camps, online courses, and certifications. A master's in Health Informatics or Health Analytics is becoming a very common and direct route into this field. And certifications like the CHDA, the Certified Health Data Analyst, can give you a major leg up by proving you have the specific competencies required for the role. So you've got the skills, you've got the passion for data-driven detective work. But how much can a health data analyst actually make? And where can this career take you? The numbers might just surprise you. Let's talk dollars and cents. According to data from sources like the Bureau of Labor Statistics, Glassdoor, and industry surveys, an entry-level health data analyst in the United States can expect to start in the range of $65,000 to $85,000 per year. Now, that's not a small number for a starting position, especially when you consider the immense room for growth. This initial role is your training ground. You're learning the ropes, mastering the specific electronic health record systems of your organization, and proving you can turn mountains of messy data into clean, actionable reports. After you've got 3 to 5 years of solid experience under your belt, you move into the mid-career bracket. Here, your value to the organization has skyrocketed. You're not just running reports anymore, you're designing them. You're anticipating the questions that leadership will ask and building dashboards to answer them proactively. At this stage, your salary typically jumps into the $95,000 to $120,000 range. You're becoming the go-to person for complex data queries, and your insights are directly influencing patient care protocols and operational efficiency. And then there's the top tier. Senior or lead health data analysts, those with 7, 10 or more years of experience, are the strategic thinkers. They're mentoring junior analysts, overseeing major projects, and collaborating with C-suite executives to shape long-term strategy. For these experts, salaries can climb well into the $130,000 to $160,000 range, and in some high-demand markets or specialized roles, even higher. Of course, these are national averages. The single biggest factor that can swing these numbers is location. A health data analyst working in a major metropolitan hub with a high concentration of hospitals, research institutions, and biotech firms, think Boston, San Francisco, New York City, or San Diego, will command a significantly higher salary than someone in a more rural area. The cost of living is higher, yes, but the demand for skilled analysts is fierce, creating a competitive market that drives wages up. Another major lever you can pull to increase your earning potential is certification. Earning a credential like the Certified Health Data Analyst, or CHDA, from a HEMA is like adding a turbocharger to your resume. It's a clear signal to employers that you have a verified, standardized level of expertise. It says you're not just someone who knows how to use Excel. You are a professional who understands the nuances of healthcare data, privacy regulations like HIPAA, and advanced analytical methods. This certification alone can add a 5 to 15% premium to your salary and open doors to more senior roles much faster. But the salary is only half the story. The real beauty of starting as a health data analyst is the career trajectory. It's not a dead-end job, it's a launch pad. Let's paint a picture. Imagine starting your career as a junior analyst at a large hospital system. For the first 2 years, you're immersed in the data. You're pulling reports on patient readmission rates, analyzing emergency room wait times, and helping the billing department identify coding discrepancies. You become an expert in SQL and Tableau, and you learn the hospital's operational heartbeat from the inside out. After a few years, you're promoted to a health data analyst too. Now, you're not just pulling data, you're interpreting it. You lead a project to analyze why certain surgical procedures have higher than average infection rates. Your analysis reveals a correlation with a specific pre-op procedure. The hospital changes its protocol based on your findings, and infection rates drop by 20%. You've just directly improved patient safety and saved the hospital hundreds of thousands of dollars. You feel the impact of your work. Seeing your success, you decide to specialize. You're fascinated by predictive analytics, so you take some advanced courses, maybe even pursue a master's degree part-time. This leads to your next role, Senior Clinical Data Scientist. Now you're in a different league. You're not just looking at what happened in the past. You're building statistical models to predict what will happen in the future. You develop an algorithm that identifies patients at high risk for developing sepsis, allowing doctors to intervene earlier. This isn't just a job anymore. You're at the absolute forefront of preventative medicine. Your work is being published, and other hospital systems are looking to adopt your model. From there, the path splinters into multiple exciting directions. You could become a manager of clinical analytics, leading a team of analysts and scientists, setting the data strategy for an entire department. You could move into a consulting role, working for a major firm and helping hospitals all over the country solve their most complex data challenges. Or, with your deep understanding of both the clinical and technical sides of the business, you could rise through the executive ranks, eventually becoming a director of Health Informatics or even a chief information officer, shaping the technological future of an entire healthcare organization. This entire journey, from a junior analyst pulling reports to a CIO setting strategy, all started with that foundational role. The health data analyst is the gateway. It provides the fundamental skills and the institutional knowledge that are absolutely essential for any high-level role in health informatics. It's where you earn your stripes and prove your worth. So the analyst role is perfect for the data detective, the person who loves to sift through the evidence to find the hidden story. But what if your passion isn't just in analyzing the systems that exist, but in designing and building the systems of the future? What if you're less of an archaeologist and more of an architect? What if you want to be the one who creates the very infrastructure that all these analysts will depend on? That requires a different set of skills, a different mindset, and it leads us directly to our fourth career path, a role that is absolutely critical to the modern healthcare ecosystem. And that role is the Health IT Implementation Specialist, or as I like to call them, the architects of the digital hospital. Imagine for a moment a brand new 10-story billion-dollar hospital. It has the most advanced MRI machines, robotic surgical arms, and automated lab equipment money can buy. It looks incredible, but on opening day it's chaos. The patient's allergy information, entered in the emergency room, doesn't show up for the anesthesiologist in the operating room. The critical lab results from the third floor don't automatically trigger an alert on the physician's dashboard on the fifth floor. The pharmacy has no idea what medications have been administered because the systems don't talk to each other. It's a digital Tower of Babel. Patient care grinds to a halt, and safety is compromised. The person who prevents this nightmare scenario, the person who transforms that collection of expensive hardware into a single cohesive intelligent organism, is the implementation specialist. This isn't just an IT job. So much more than that. These professionals are the ultimate translators, the bridge between the world of clinical medicine and the world of complex software engineering. They don't just install a program from a disk. They are tasked with taking a colossal labyrinthine piece of software, an electronic health record or EHR system, from a giant like Epic or Cerner, and meticulously weaving it into the very fabric of a hospital's operations. What does that actually mean? It means they start by shadowing doctors on their rounds. They sit with nurses at their stations for hours, observing every click, every frustration, every workaround. They listen to pharmacists, lab technicians, and billing clerks to understand the unique, intricate dance of their daily workflows. They have to understand not just what these clinicians do, but why they do it that way. Then they take that deep, empathetic understanding and translate it into the language of the system. They configure thousands upon thousands of settings. They build customized order sets so a doctor can prescribe a complex chemotherapy regimen with a few clicks, guided by safety checks and best practices. They design the digital screens and flowcharts that nurses will use to document patient care, making them intuitive and efficient, not clunky and time-consuming. They ensure that when a lab result comes back critical, it doesn't just sit in a digital inbox. It triggers a series of alerts that cannot be ignored. The impact of their work is monumental, and it touches every single patient. When done well, it is a powerful force for good. A properly configured EHR can be the difference between a near miss and a fatal medication error. It can slash the time doctors spend on paperwork, giving them more time for the human side of medicine, actually talking to their patients. It ensures the hospital gets paid correctly for the services it provides, keeping the lights on and the doors open. And crucially, they are the gatekeepers of data quality. The brilliant analysts we talked about earlier, their work is only as good as the data they receive. The implementation specialist is the one who ensures that the data being entered into the system is structured, clean, and reliable from the very beginning. They create the clean wellspring from which all other data insights will flow. So, what does it take to become one of these digital architects? The skill set is a fascinating hybrid. On one hand, you need a strong technical aptitude. You don't have to be a hardcore coder, but you need to be able to think in terms of systems, logic, and databases. You have to be comfortable learning incredibly complex software inside and out. In fact, one of the golden tickets in this field is getting a certification in a specific EHR system like Epic. These certifications are notoriously difficult to get. You usually have to be sponsored by a hospital or consulting firm that's hiring you, but once you have one, you become incredibly valuable. But the technical skills are only half the equation. The other half, and arguably the more important half, is clinical and operational understanding. This is why so many of the best implementation specialists are former nurses, pharmacists, medical technologists, or even physicians. They've lived in the trenches. They understand the pressure, the urgency, and the language of healthcare. When a surgeon says they need a workflow to be more intuitive, a former nurse-turned-specialist knows exactly what that means in a practical sense. They have instant credibility with the clinical staff they are trying to help. And layered on top of all that are elite-level soft skills. This is a project management and change management role at its core. You are fundamentally changing the way hundreds, or even thousands of highly trained professionals do their jobs. You will face resistance. You need to be an incredible communicator, a patient teacher, and a persuasive leader. You are part diplomat, part therapist, and part technical wizard, all rolled into one. A day in the life is a whirlwind of high-stakes problem-solving. Your morning might start in a war room meeting, planning the final stages of a massive go-live event where an entire hospital switches to the new system overnight. Then you might rush to the ICU to do at-the-elbow support, literally standing beside a doctor as they use the system for the first time on a real patient, answering questions and fixing issues on the fly. In the afternoon, you could be in a conference room, leading a training session for a group of skeptical nurses, patiently winning them over by showing how the new system will make their jobs easier, not harder. You're constantly moving, thinking, and communicating. Because of this unique and demanding blend of skills, the compensation is excellent. An EHR implementation specialist can easily command a salary well into the six figures. Senior specialists, project managers, and independent consultants who travel from hospital to hospital can earn significantly more, often pushing $200,000 or beyond. The career trajectory is fantastic. You can specialize in a particular clinical area like oncology or cardiology, become a team lead, a project manager, or move into a leadership role like a hospital's chief medical or nursing information officer. The demand is relentless because hospitals are constantly upgrading their systems, acquiring new clinics, and striving to get more value out of their massive technology investments. So if you're someone with a clinical background who loves technology and wants to make a broader impact, this could be your calling. Or if you're a tech-savvy person who is fascinated by the complexities of healthcare and wants to be at the heart of the action, this is a path you must consider. You are the one who takes the promise of digital health and makes it a reality, one workflow, one screen, one life-saving alert at a time. Now, we've talked about analyzing the data, and we've talked about building the systems that collect the data. But all of this, every patient record, every diagnosis, every prescription, is some of the most sensitive and personal information on the planet. Protecting it from prying eyes and malicious attacks isn't just an IT problem. It's a matter of national security and profound ethical responsibility. And that brings us to our fifth and final career path, a role that operates in the shadows to protect the very soul of the healthcare system. The Health Information Security Analyst. Imagine this. It's 3 a.m. The emergency room of a major city hospital is a whirlwind of controlled chaos. A multi-car pileup has just flooded the floor with patients. A surgeon is scrubbing in, ready to perform a life-saving operation. A nurse is about to administer a critical dose of medication to a patient in septic shock. And then everything stops. The monitors go blank. The digital patient charts vanish, replaced by a single terrifying message demanding a ransom in Bitcoin. The network that connects the pharmacy, the lab, and the operating rooms is completely paralyzed. The surgeon can't access the patient's MRI scans. The nurse can't verify the drug dosage against the patient's known allergies. The intricate, data-driven web that modern medicine relies on has been severed. This isn't a scene from a movie. This is the nightmare scenario that health information security analysts live to prevent. They are the digital guardians, the silent sentinels standing watch over the most sensitive data on the planet. While doctors and nurses fight diseases on the front lines, these analysts fight a hidden war in the realm of ones and zeros. Their battlefield is the hospital's network, and their enemy is a faceless, relentless adversary trying to exploit any weakness for profit or chaos. So what does this digital protector actually do? Their job is a fascinating blend of detective work, strategic planning, and rapid-fire crisis management. They are professional paranoids paid to think like a hacker. They conduct what are called penetration tests, which is a fancy way of saying they are legally and ethically paid to try and hack their own hospital systems. They're looking for the unlocked digital window, the weak password, the unpatched software, the tiny crack a real attacker could burst through. They design and build the digital fortress, brick by encrypted brick. They implement firewalls, intrusion detection systems, and sophisticated access controls, ensuring that only the right people can see the right information at the right time. But their job goes far beyond technology. A huge part of their role is human. They are teachers, training doctors, nurses, and administrators to spot phishing emails, those deceptive messages designed to steal credentials. They understand that the strongest security system in the world can be undone by a single careless click. And when an attack does happen, because in today's world, it's not a matter of if, but when, they become the incident responders. They are the digital SWAT team that swoops in to contain the breach, eject the intruder, and restore the systems. They work under immense pressure, knowing that every second the network is down, patient lives are at risk. This is where code meets the Hippocratic Oath. It's a career where your technical skills have a direct, tangible, and profound impact on human well-being. To become one of these guardians, you need a unique combination of skills. A background in computer science, information technology, or cybersecurity is often the starting point. But it's the certifications that really open doors. Think of credentials like the CISSP, Certified Information Systems Security Professional, or the CISM, Certified Information Security Manager. These are the gold standards, signaling to employers that you have a deep, proven understanding of the field. But more than any degree or certification, you need a specific mindset. You have to be meticulous with an almost obsessive attention to detail, because a single misplaced line of code can be a fatal vulnerability. You need to be endlessly curious, always learning about the latest threats and hacker techniques. And most of all, you need to be calm and decisive under unimaginable pressure. When the alarms are blaring and the system is under attack, panic is not an option. Now let's talk about the reward for carrying this immense responsibility. The demand for cybersecurity professionals, especially in healthcare, is exploding. The U.S. Bureau of Labor Statistics projects the role of information security analysts to grow by a staggering 32% over the next decade, which is astronomically faster than the average for all occupations. This isn't just a job. It's one of the most secure career paths you can choose. And the compensation reflects that. An entry-level health information security analyst can expect to start in the range of $75,000 to $95,000 a year. With a few years of experience in those key certifications, that number quickly climbs into the six figures, with senior analysts and managers easily commanding salaries of $150,000 or more. In major metropolitan areas or for large healthcare systems, top-tier cybersecurity leaders can earn well over $200,000 annually. This is a field that rewards expertise and recognizes the critical value you provide. You're not just protecting data. You're protecting the hospital's ability to function, safeguarding patient trust, and literally saving lives. So there you have it, the 5 pillars of health informatics in the United States. We started with the architects of the system, the Clinical Informatics Specialists, who bridge the gap between the bedside and the computer screen. We moved to the storytellers, the health data analysts, who transform raw numbers into life-saving insights and predictions. We explored the strategists, the health informatics consultants, the elite problem solvers who parachute in to overhaul entire systems for maximum efficiency and impact. We met the innovators, the health IT project managers, the conductors who orchestrate massive technological upgrades, ensuring every piece comes together on time and on budget. And finally, we unveiled the guardians, the Health Information Security Analysts, who protect the entire ecosystem from the constant threat of cyber warfare. From architect to analyst, strategist to sentinel, each of these roles is a powerhouse in its own right. Each offers a path to a high-impact, high-paying career that sits at the absolute cutting edge of technology and human health. Together, they form the backbone of our modern medical system. So we've explored the what, the 5 most powerful roles shaping the future of medicine. But knowing the destination is only half the journey. The real question is, how do you get there? What's the map? What are the secret shortcuts and the hidden traps you need to avoid on your way to landing one of these incredible jobs? Because getting the degree is one thing, but breaking into this fiercely competitive field, crafting the perfect resume, acing the technical interview, and negotiating the salary you deserve, that is a completely different game. And in the next part, we're going to give you the playbook. We're going to break down the exact actionable steps you need to take to go from where you are right now to sitting in the chair of your dream health informatics job. You've seen the careers. Now it's time to build the road to get you there. All right, let's lay the first stone of your career path. The foundation for almost every role we've discussed is education. But here's the secret. There isn't just one right degree. This field is a melting pot, and that's its biggest strength. You could be coming from a purely technical background like computer science or information systems. You understand databases, networks, and software development. Your challenge isn't the tech. It's learning the language and the workflow of healthcare. You need to understand why a doctor clicks here and a nurse documents there. Or you could be coming from the clinical side. You're a nurse, a medical assistant, a pharmacist. You live and breathe patient care. You understand the chaos of a hospital floor. Your challenge is the opposite. You need to build the technical skills to translate your real-world problems into technological solutions. Both paths are equally valid and incredibly valuable. For a bachelor's degree, strong starting points are health information management, computer science, public health, or even a clinical degree like a Bachelor of Science in nursing. These give you a solid base. But let's be honest, the real magic, the career acceleration, often happens at the graduate level. A Master of Science in Health Informatics, or MSHI, is the gold standard. It's specifically designed to merge healthcare and technology. Other fantastic options are a Master of Public Health with an informatics concentration, or a Master of Information Systems with a healthcare focus. These programs are your dedicated training ground, where you'll learn the theory and, crucially, get hands-on experience. But a degree is just the entry ticket. To actually win the game, you need skills. Tangible, provable skills that you can put on a resume and demonstrate in an interview. Let's build your toolkit piece by piece. First, and this is non-negotiable, is SQL, or structured query language. Think of it like this. Every piece of patient data, every lab result, every diagnosis, every prescription, is stored in massive digital filing cabinets called databases. SQL is the language you use to ask those filing cabinets for information. You're not just pulling one file. You're asking complex questions like, show me all diabetic patients over the age of 60 who were admitted for heart failure in the last year and are on medication X. That question, translated into SQL, can generate a report that helps a hospital improve patient outcomes. It is the bedrock of healthcare analytics. You absolutely must learn it. The good news? You can learn the fundamentals for free on sites like W3 Schools or Khan Academy. Don't just learn it. Practice it until it's second nature. Next up, you need to understand electronic health record systems, or EHRs. These are the software platforms at the heart of modern healthcare, like Epic, Cerner, or Allscripts. Now, you can't just go download Epic and play with it on your laptop. Access is tightly controlled. So how do you get experience? First, many university programs have partnerships that give you access to educational or sandbox versions of these EHRs. It's a huge selling point, so ask about it when you're looking at schools. If you're not in a formal program, get your foot in the door of a healthcare setting in any capacity. Even an entry-level job in patient registration will expose you to the front end of an EHR. You'll learn the terminology, the workflow, and the pain points firsthand. This real-world context is priceless. The third technical skill is data visualization. It's not enough to pull data with SQL. You have to tell a story with it. A hospital executive doesn't have time to decipher a 10,000-row spreadsheet. They need a clear, intuitive dashboard that shows them, in 30 seconds, whether readmission rates are going up or down. This is where tools like Tableau and Power BI come in. They turn raw data into powerful stories. And here's your action item. Go to the Tableau public website. It's a free version of their software. You can download public health datasets from the CDC, for example, and start building your own dashboards. Create a project analyzing flu trends or vaccination rates. This becomes part of your portfolio, which we'll talk about later. It's tangible proof you can do the work. Finally, for those who want to reach the highest levels, consider learning a programming language like Python or R. You don't need to be a Google-level software developer, but knowing Python, specifically with a library called Pandas, is like having a Swiss Army knife for data. It lets you clean, manipulate, and analyze massive datasets far more powerfully than Excel ever could. R is the king of statistical analysis, essential for research and public health roles. Think of these languages as a power-up. They're not always required for entry-level jobs, but they open the door to more senior, higher-paying data science and analytics positions. Now let's switch gears from the informatics to the health. You cannot succeed in this field if you don't understand the world you're working in. You need healthcare domain knowledge. You need to understand the difference between a deductible and a copay. You need to know what HIPAA is, the Health Insurance Portability and Accountability Act. And don't just know the acronym. Understand what it means. It is the sacred law that governs patient privacy and security. A breach isn't just a mistake. It's a multi-million-dollar catastrophe that erodes patient trust. You can learn this by reading. Follow industry news sites like Fierce Healthcare or Stat News. Take a free online course in medical terminology. Understand the basic flow of a patient's journey, from scheduling an appointment to being discharged from the hospital. This knowledge allows you to speak the same language as the doctors and nurses you're there to help. And that brings us to the most underrated skills of all, the soft skills. You can be a technical genius, but if you can't communicate, you will fail. In health informatics, you are the translator. You are the bridge between the clinical world and the IT world. You have to be able to listen to a surgeon describe a problem in plain English, understand their frustration, and then turn around and translate that into a detailed technical specification for a developer. Then you have to translate the developer's technical solution back into a simple, clear explanation for the surgeon. This ability to speak two languages is your superpower. You also need to be an obsessive problem solver. Your job is to fix things. When a system goes down or a report is inaccurate, you are the detective who has to follow the clues and find the root cause. It requires curiosity, patience, and a logical mind. Finally, you need a solid grasp of project management. Implementing a new feature in an EHR isn't a casual task. It's a massive project that affects thousands of users and patient safety. Understanding methodologies like Agile, which is all about breaking big projects into small, manageable chunks and adapting as you go, is critical for ensuring projects are completed on time and on budget. So we have education, technical skills, domain knowledge, and soft skills. But that leaves the single biggest question I get. How do I get a job with no experience? This is the classic catch-22. You need experience to get a job, but you need a job to get experience. This is where you have to be smarter and more creative than everyone else. The single most powerful weapon against the no experience problem is a portfolio. A resume lists what you say you can do. A portfolio proves what you can do. Remember that Tableau dashboard we talked about? That's the star of your portfolio. That project where you use Python to analyze a public health dataset? That's in your portfolio. Write a short blog post explaining your process and your findings. This is infinitely more impressive to a hiring manager than a simple bullet point that says, proficient in Tableau. It shows initiative, passion, and tangible skill. Next, get your foot in the door any way you can. Look for internships. Volunteer at a local clinic or hospital, even if it's just helping them with basic IT support. It's all about exposure and making connections. And speaking of connections, you have to network. I know for some of you that word makes your skin crawl, so let's reframe it. Don't think of it as networking. Think of it as learning from people who are already where you want to be. Go on LinkedIn. Find people with titles like Clinical Analyst or Informatics Nurse at companies you admire, and send them a simple, polite message. Don't ask for a job. Ask for their story. Say something like, "Hi name. I'm an aspiring health informatics professional, and I'm incredibly impressed by your work at company. Would you be open to a brief 15-minute virtual coffee chat? I'd love to learn more about your journey into the field." People love to share their story and help others who are just starting out. These informational interviews will give you more real-world insight than any textbook, and you'll be building a network of advocates who might just think of you when a position opens up. Join professional organizations like HIMSS or AMIA. They have local chapters that host events where you can meet people in the field. Finally, let's talk about certifications. While a degree gets you in the door and skills get you the job, certifications can accelerate your career and boost your salary. They are a formal validation of your knowledge. Certs like the KHIMS for entry-level folks or the KFIMS for more experienced professionals, both from HMSS, are highly respected. If you're coming from a health information management background, the RHIA is a powerhouse. And then there are the vendor-specific certifications like becoming EPIC certified. These are often the holy grail. Typically, a hospital will hire you and then pay for you to go through the rigorous EPIC certification process. Once you have that on your resume, you become incredibly marketable. This is your roadmap. Education is the foundation. The skills are the vehicle. And your portfolio and your network are the fuel that will get you to your destination. It's a lot, I know, but you don't have to do it all at once. Pick one thing. Learn SQL this month. Build a Tableau project next month. Reach out to one person on LinkedIn this week. It's about consistent, forward progress. Every small step you take is another stone laid on the path to your future. And some of the most powerful paths are forged by those who have already walked the hospital floors, who have held a patient's hand, who understand the rhythm of a 12-hour shift not from a textbook, but from lived experience. This brings us to our third career path, a role that is less about building systems from scratch and more about humanizing the technology we already have. This is the role of the ultimate translator, the clinical champion, the bridge between the bedside and the server room. This is the world of the informatics nurse specialist. To understand the profound impact of this role, let me tell you about Sarah. Sarah was a phenomenal nurse. For 8 years, she worked in the Med-Surg unit of a large urban hospital. She was calm under pressure, deeply compassionate, and clinically sharp. But something was wearing her down, and it wasn't the long hours or the difficult cases. It was the technology. A few years prior, the hospital had rolled out a brand new multi-million-dollar electronic health record system, the EHR. It was promised to be a revolution, a tool that would streamline care, reduce errors, and make her job easier. The reality was a nightmare. The user interface was a labyrinth of confusing tabs and tiny buttons. To document a simple medication administration, Sarah had to click through 7 different screens. The system would fire off constant, meaningless alerts, a phenomenon nurses call alert fatigue, until everyone just started ignoring them, creating a massive patient safety risk. She watched brilliant, experienced nurses, people she looked up to, develop dangerous workarounds just to get through their shift. They document medications an hour after giving them, copy and paste old notes without updating them, all because the system was actively working against them. The technology designed to save lives felt like it was putting them at risk. One night, after a particularly grueling shift where a medication order was delayed because of a system glitch, Sarah sat in her car in the hospital parking lot, completely drained. She wasn't just tired, she was angry. She saw the immense potential of technology, but she also saw the canyon-sized gap between the software engineers who designed the system and the nurses who were forced to use it. The IT department saw nurses as end users who needed to be trained. The nurses saw the IT department as out-of-touch techies who didn't understand what it's like to have a patient crashing in front of you. And in that moment of frustration, Sarah had an epiphany. What if she could be the bridge? What if, instead of just complaining about the system, she could be the one to fix it? She had the clinical knowledge. She understood the workflow, the pressures, the life-or-death realities of the hospital floor. All she needed were the technical skills to speak the language of the developers. That night, she went home and started researching. She discovered the field of nursing informatics. It was like a light bulb went off. This was it. This was the path. She enrolled in an online Master of Science in Nursing program with a specialization in informatics. For the next 2 years, she worked her hospital shifts on the weekends and spent her weekdays immersed in classes on database management, systems analysis, and project management. It was exhausting, but for the first time in years, she felt a sense of purpose beyond her immediate patient care. When she graduated, a position for an informatics nurse specialist opened up at her very own hospital. She applied, and her interview was less of a Q&A and more of a strategy session. Armed with her frontline experience and her new technical knowledge, she laid out a plan to fix the very issues that had plagued her and her colleagues for years. She got the job, and the change was immediate. Sarah wasn't just a nurse anymore. She was an architect of a better clinical environment. Her first project was to tackle the medication administration workflow. She sat with the IT team not as an angry nurse but as a partner. She drew out the workflow on a whiteboard, explaining every step, every potential pitfall, every moment where a nurse needed critical information. The developers, seeing the process through her eyes for the first time, had their own aha moment. Together, they redesigned the interface, cutting the process from 7 clicks down to 2. Next, she tackled alert fatigue. She conducted a deep dive analysis of every alert firing in the system. She worked with pharmacists, physicians, and other nurses to determine which alerts were truly critical and which were just noise. They customized the alert parameters, turning a fire hose of useless information into a targeted stream of life-saving warnings. Within 6 months, non-critical alerts were down by over 80%, and nurses reported that they were finally paying attention to the ones that mattered. Sarah became the go-to person for technology on the clinical floors. She wasn't just training nurses on how to use the system, she was empowering them. She created feedback channels, giving her former colleagues a direct line to the IT department. She was their advocate, their translator, and their problem solver. Her impact had scaled. As a floor nurse, she could provide amazing care to a handful of patients each shift. As an informatics nurse specialist, she was improving the quality and safety of care for every single patient who entered the hospital. Sarah's story is the perfect embodiment of what an informatics nurse specialist does. They are the essential liaison between the clinical and technical worlds. They analyze clinical workflows and find ways to optimize them with technology. They help design, implement, and test new systems, ensuring they actually meet the needs of the clinicians who will use them. They are educators, change managers, and data stewards, ensuring the information flowing through the hospital is accurate, useful, and secure. To become an informatics nurse, the journey almost always begins with a nursing license. You need to be an RN, typically with a Bachelor of Science in Nursing or BSN. More importantly, you need that frontline clinical experience. You can't optimize a workflow you've never performed. Most positions look for at least 2 to 5 years of hands-on nursing experience. From there, the path typically involves advanced education. A master's degree in nursing informatics is the gold standard and will open the most doors. But postgraduate certificates are also a fantastic way to specialize. Finally, getting board certified, like the American Nurses Credentialing Center's Informatics Nursing Certification, is the ultimate stamp of approval. It validates your expertise and makes you a highly sought-after candidate. And the demand is off the charts. As healthcare becomes more reliant on technology, the need for professionals who can bridge that clinical tech gap is exploding. The salary reflects this critical need. While it varies by location and experience, the average salary for a nurse informaticist in the United States ranges from $95,000 to over $130,000 a year, with senior and leadership roles pushing well beyond that. This role is for the problem solvers, the communicators, the nurses who look at a broken process and see an opportunity for improvement. It's for those who want to scale their impact from one-on-one patient care to improving the entire system of care for thousands. It's about taking that incredible compassion and clinical judgment that makes a great nurse and applying it to the very tools that shape modern medicine. If the clinical analyst we discussed earlier is the mechanic who understands how the engine works, and the health data scientist is the traffic controller analyzing patterns from above, the informatics nurse specialist is the expert driver with years of experience on the road. They're the one who can give the engineers direct, invaluable feedback on how to build a better, safer, and more intuitive vehicle, ensuring it actually serves the needs of the person behind the wheel. And in healthcare, that focus on the human user isn't just a matter of convenience. It's a matter of life and death. This brings us to our number 2 career path, one that lives and breathes at this exact intersection of technology and human life: the Clinical Informatics Specialist. Imagine this. It's 2 a.m. in a busy city emergency room. The air is thick with a controlled chaos, the rhythmic beep of monitors, the urgent murmur of voices, the squeak of sneakers on linoleum. A nurse, let's call her Maria, is at a computer terminal, her face illuminated by the screen's glow. A patient has just been brought in, short of breath, chest tight, with a known severe allergy to a common class of antibiotics. This is a critical piece of information, the difference between life and death. Maria needs to enter this allergy into the patient's brand new electronic health record, or EHR, before the doctor prescribes anything. But the system, this multi-million-dollar piece of software, is fighting her every step of the way. To log the allergy, she has to click through 5 different screens. A pop-up window for a non-urgent system update is blocking the field she needs. The drop-down menu for allergies is 1,000 items long and isn't searchable. Her stress level is rising. Every second spent wrestling with this clunky interface is a second not spent at the patient's bedside. She finally manages to input the information, but it's buried under a tab labeled Miscellaneous History, not flagged prominently on the main summary screen where the doctor will be looking. It's a digital landmine, waiting for someone to step on it. This isn't a hypothetical. This is the reality in countless hospitals across the country. We've built these incredibly powerful digital systems to hold patient data, but we often forgot about the human beings who have to use them under immense pressure. The result? Frustration, wasted time, and a terrifying potential for medical errors. Clinician burnout is at an all-time high, and a significant part of that burnout isn't the patients, it's the technology that was supposed to help. Now into this chaotic ER walks our hero, the Clinical Informatics Specialist. Let's call him Ben. Ben isn't just an IT guy. Ben used to be a paramedic. He has spent years in the back of an ambulance, making split-second decisions. He understands the pressure Maria is under because he's felt it himself. He speaks her language. He's the translator, the bridge between the world of medicine and the world of code. His job isn't to sit in a basement office and write code. His job is to stand right there beside Maria. He watches her workflow. He sees the 7 clicks it takes to order a simple blood test. He sees her frustration as she navigates the labyrinthine menus. He asks questions the original software designers never did. What is the single most important piece of information you need to see on this screen right now? If you had a magic wand, what would this system do for you at this exact moment? Ben takes that real-world, high-stakes feedback and translates it into a language the software developers can understand. He goes to the IT team and says, "Look, we don't need another pop-up. We need a permanent, red, flashing banner at the top of the screen for any severe allergy. The allergy field needs to be a predictive text search bar, not a drop-down menu. And the 7 clicks to order a blood test? We need to make that 1 click from the main screen." He is the advocate for the end user. He is the guardian of sanity in a world of complex software. He champions the idea that technology must conform to the clinical workflow, not the other way around. A few months later, the system is updated. Maria logs in and the change is immediate. The interface is cleaner. When she pulls up her new patient's chart, a prominent red banner at the top already displays his critical allergy, pulled automatically from his previous medical records. Ordering labs is now a single click. She can document vital signs in a fraction of the time. The technology has become an invisible, helpful partner rather than a clumsy, demanding obstacle. The impact is monumental. Medical errors decrease. Patient safety skyrockets. And Maria? She can now spend more time doing what she was trained to do, caring for her patients. She goes home at the end of her shift feeling less frustrated, less defeated by the technology. Ben, the Clinical Informatics Specialist, didn't just fix a piece of software. He helped restore the human connection at the heart of healthcare. So what does this incredible role actually involve? A Clinical Informatics Specialist is a healthcare professional, often a nurse, pharmacist, or physician, who has specialized in information science. Their daily life is a mix of detective work, diplomacy, and design. They conduct workflow analyses, shadowing clinicians to map out every step of their process. They help design, implement, and test new IT systems, ensuring they are clinically sound and user-friendly. They are the primary trainers for new software, teaching staff not just which buttons to click, but how the technology can improve their practice. They are the crucial liaison, sitting in meetings with both hospital executives and IT developers, ensuring everyone is speaking the same language and working toward the same goal: better patient outcomes. To become one, you need a unique blend of skills. First and foremost, you need a clinical background. A Bachelor of Science in Nursing is a very common starting point, followed by several years of hands-on experience in a hospital or clinic. That real-world experience is your currency. It gives you the credibility and deep understanding necessary to be effective. After that, the next step is specialized education, typically a master's degree in health informatics or a more specialized track like nursing informatics. Certifications are also highly valued, like the Informatics Nursing Certification from the American Nurses Credentialing Center, which signals a high level of expertise. But beyond the degrees and certifications, you need empathy. You have to be able to feel the user's pain. You need to be a fantastic communicator, able to explain complex technical concepts to a non-technical doctor, and then turn around and explain the nuances of a clinical emergency to a software engineer. You are a problem solver at your core, someone who sees a broken process and immediately starts thinking about how to fix it. Because this role is so specialized and provides such immense value, it's also incredibly well compensated. A clinical informatics specialist in the United States can expect to earn a salary ranging from $90,000 to over $145,000 a year. Senior specialists, especially those who move into management or director-level roles, can command even higher salaries. And the demand is exploding. The U.S. Bureau of Labor Statistics projects that jobs for medical and health services managers, a category that includes informatics specialists, will grow by 28% over the next decade. That is vastly faster than the average for all occupations. As healthcare becomes ever more reliant on technology, the need for these human-centric experts who can make that technology work for people is only going to intensify. The Clinical Informatics Specialist is a true hybrid professional, blending the compassion of a caregiver with the analytical mind of a technologist. They don't just manage data or systems, they manage the critical point where data, technology, and human lives converge. They are the unsung heroes making our digital hospitals safer, smarter, and more humane. So far, we've explored the data detectives who find the patterns, the health data analysts, and the clinical translators who perfect the systems, the clinical informatics specialists. Both roles work within a vast digital ecosystem. But who builds the blueprint for that ecosystem? Who designs the massive, complex, and secure architecture that allows a hospital, or even an entire network of hospitals, to function? That brings us to the very pinnacle of our list: the Health Informatics Architect, or, in its most senior C-suite evolution, the Chief Health Informatics Officer. This isn't just a job title, it's a statement. It's the role that sits at the intersection of medicine, technology, and business strategy, holding the digital fate of an entire healthcare organization in its hands. If a hospital is a living organism, the CHIO is the mind, designing and managing its central nervous system. Think about the construction of a modern skyscraper. Before a single piece of steel is erected, an architect spends months, even years, creating a detailed blueprint. They don't just decide where the walls go. They design the electrical grid, the plumbing systems, the HVAC, the structural supports, every invisible system that allows the building to function, to breathe, to be safe. They have to anticipate how thousands of people will move through the space, what their needs will be, and how the building will stand for the next 50 or 100 years. Now replace that skyscraper with a multi-billion-dollar hospital system. The Health Informatics Architect is that master planner. They aren't installing software. They are designing the entire digital reality of the organization. Their blueprint isn't on paper. It's a strategic vision for how information will be created, stored, secured, shared, and utilized to save lives. They are the ones who have to answer the colossal questions. How do we build a system where a radiologist's imaging report from an outpatient clinic is instantly and securely available to a surgeon in the operating room 5 miles away, on a tablet, in the middle of a critical procedure? How do we integrate a new cutting-edge telehealth platform with our 30-year-old billing system without causing a total meltdown? How do we design a network that can withstand a sophisticated ransomware attack, while simultaneously allowing thousands of doctors, nurses, and staff to access patient data every single second of the day? The architect looks at the entire puzzle: the electronic health record system, the patient portal where you book appointments, the pharmacy's medication dispensing system, the laboratory information system, the picture archiving system for X-rays and MRIs, the financial software. All of these are disparate pieces. The architect's job is to design a framework where these pieces don't just coexist, but communicate in a perfect, harmonious symphony. They are the ultimate champion of interoperability, ensuring that data flows like water, reaching where it's needed, when it's needed, without friction or error. The responsibility is staggering because the stakes are literally life and death. A flaw in the physical architecture of a hospital might lead to a leaky roof. A flaw in the information architecture can lead to a patient receiving the wrong medication because their allergy information, stored in a separate system, wasn't accessible. A poorly designed user interface, a decision made by the architect's team, could lead to a tired resident clicking the wrong button at 3 a.m., with devastating consequences. This is why the role is so much more than just being a tech guru. A great CHIO or architect understands the human element of healthcare on a profound level. They spend time walking the floors of the emergency department to understand the chaos, and the pressures a nurse is under. They sit with surgeons to understand precisely what information they need on screen during an operation. They talk to patients to understand their frustrations with trying to access their own health records. They have to possess deep empathy because every line of code, every network protocol, every data standard they implement ultimately touches a human life. So, how does one even get here? You don't just graduate and become a health informatics architect. This is the summit you reach after a long and challenging climb. The journey often starts in one of two places: the clinic or the server room. Many of the best CHIOs started their careers as nurses, pharmacists, or even physicians. They lived the daily frustrations of clunky software and disconnected systems. They saw the potential for technology to do better, and they became passionate advocates for change, eventually moving from the bedside to the boardroom. Others start on the technical side as software developers, network engineers, or data analysts. They mastered the ones and zeros, but realized that to have a real impact in healthcare, they needed to understand the why behind the technology. They had to learn the language of medicine, the complexities of clinical workflows, and the labyrinth of healthcare regulations like HIPAA. Regardless of the starting point, the path converges. It requires years of progressive experience. You might start as an analyst, become a project manager for an EHR implementation, then a director of clinical informatics, and then a vice president of information technology. Along the way, you are not just building technical skills. You are building a rare and potent combination of leadership, strategic vision, and political savvy. You have to be a master communicator, capable of explaining a multi-year, $50 million cybersecurity strategy to a board of directors who might not know the difference between a server and a router. You have to be a skilled negotiator, bringing together warring department heads, each convinced their software is the most important, to agree on a unified enterprise-wide solution. And you have to be a visionary, looking 5 to 10 years into the future, anticipating how technologies like AI, genomic data, and wearable sensors will fundamentally change the hospital, and building the foundation for that future today. An advanced degree is almost always a prerequisite. A master's in health informatics, a Master of Health Administration (MHA), or an MBA with a healthcare focus is common. Certifications like the Certified Healthcare CIO (CHCIO) from the College of Healthcare Information Management Executives also signal that you have reached an elite level of expertise and leadership. And now for the question that's on everyone's mind. What is the reward for bearing this immense responsibility? As you'd expect for a C-suite executive role, the compensation is substantial. A chief health informatics officer at a major U.S. hospital system can expect a salary well into the six-figure range, commonly starting around $250,000 and often exceeding $400,000 or even $500,000 per year, not including significant bonuses and other executive compensation. It is one of the highest-paid positions in the entire field of health informatics. But for the people who reach this peak, the money is often secondary to the impact. Imagine the satisfaction. You spend 2 years leading a massive project to deploy a new predictive analytics platform. It's a nightmare of technical glitches, budget overruns, and staff resistance. But finally it goes live. And 6 months later, the data shows that the system, which flags patients at high risk for developing sepsis, has led to a 20% reduction in mortality from that very condition. You didn't treat a single patient yourself, but your work, your vision, your persistence saved dozens of lives. That is the true compensation. The health informatics architect and the CHIO are the conductors of the entire orchestra. They ensure every instrument, from the oldest legacy system to the newest AI algorithm, plays in tune, creating a seamless composition that results in safer, more effective, and more humane healthcare. They are the ultimate problem solvers, the strategists, the visionaries who are not just participating in the digital transformation of medicine, they are leading it. And that brings us to the summit, the #1 career path in health informatics in the United States. We've journeyed from the front lines of clinical analysis to the strategic heights of consulting. But there is one role that combines clinical authority, technological vision, and executive power into a single transformative position. A role so critical, it sits in the C-suite, shaping the destiny of entire healthcare organizations. The #1 career path is the Chief Medical Information Officer, or CMIO. This is not just a job. It is the pinnacle of clinical and technological leadership. The CMIO is the ultimate bridge, the master translator, the final authority on how technology will be woven into the fabric of patient care. In most cases, the CMIO is a physician, an MD or a DO, who has not only practiced medicine but has also developed a deep, passionate expertise in informatics. They haven't just used the technology. They've seen its flaws, imagined its potential, and decided to step out of the exam room and into the boardroom to fix it on a massive scale. Imagine the internal conflict at a major hospital. The IT department, focused on security, budgets, and system stability, wants to roll out a new software update. The physicians on the floor, however, see it as just another series of clicks, another layer of bureaucracy standing between them and their patients. They see it as a burden, not a benefit. Who resolves this? Who can speak both languages fluently? Who understands the back-end architecture and the front-end burnout? CMIO. A day in the life of a CMIO isn't about writing code or running queries. It's about commanding a room. It's a morning spent meeting with the heads of cardiology and oncology to understand their unique workflow challenges. It's an afternoon negotiating with a multi-million-dollar software vendor, holding their feet to the fire on promises of interoperability and user-friendliness. It's an evening presenting the 5-year digital health strategy to the hospital's board of directors, justifying massive investments in AI-powered diagnostics or a new telehealth platform by articulating a clear vision for improved patient outcomes and return on investment. The CMIO is the conscience of the health system's technological soul. Their core responsibilities are immense. First, they are the primary strategist. They don't just ask, "What software should we buy?" They ask, "In 10 years, how will our clinicians and patients interact with information to create the best possible health outcomes? And what foundational steps do we need to take today to build that future?" They are playing chess while others are playing checkers. Second, they are the chief physician advocate. They are the voice of every frustrated doctor, every overwhelmed nurse, in every technology-related decision. They fight to ensure that new systems reduce administrative burden, not add to it. They champion tools that are intuitive, that surface the right information at the right time, and that genuinely augment a clinician's ability to heal. Their credibility comes from the fact that they've been there. They've lived the 3 a.m. pager calls and the chaotic emergency room shifts. When they speak, clinicians listen. Third, the CMIO is a driver of clinical quality and safety. They lead the initiatives that use data to make healthcare safer. This means overseeing the development of clinical decision support systems that can flag potential drug interactions, alert doctors to signs of sepsis, or use predictive analytics to identify patients at high risk for readmission. They are using data not just to look back at what happened, but to actively change what will happen next, saving lives in the process. To become a CMIO is to pursue a dual mastery. You need the unshakable clinical credibility that comes from a medical degree and years of practice. But you also need profound informatics expertise, often formalized through a master's degree or a fellowship in clinical informatics. You need to understand data architecture, system security, and the nuances of workflow design, as well as you understand human anatomy and pharmacology. And layered on top of all of that is the most crucial skill: leadership. The ability to communicate a vision, build consensus among skeptical stakeholders, manage massive projects, and inspire profound organizational change. Because of this rare and powerful combination of skills, the compensation for a CMIO is at the absolute top tier, regularly reaching deep into the 6 figures and beyond, commensurate with other C-suite executives. But the true reward isn't just financial. It's about the sheer scale of impact. A physician in a clinic can heal the hundreds of patients they see each year. A CMIO can fundamentally improve the quality, safety, and efficiency of care for hundreds of thousands, or even millions, of patients by building a better system for everyone. They are the ones who heal the healthcare system itself. So there you have it. Our journey through the top 5 career paths in health informatics has taken us from the essential data-driven work of the clinical analyst at number 5 to the predictive and powerful world of the health data scientist at number 4. We saw the critical, project-based role of the EHR implementation specialist at number 3, and the strategic, problem-solving prowess of the health informatics consultant at number 2. And finally, we reached the summit with the ultimate clinical and tech leadership role, the Chief Medical Information Officer at number 1. What is the common thread that ties all of these roles together? It's the fundamental belief that better information leads to better health. It's the understanding that the single most powerful tool in modern medicine is no longer just the scalpel or the stethoscope, but the intelligent, ethical, and compassionate use of data. Each of these paths represents an opportunity not just to find a job, but to find a mission. Whether you are driven by data, by technology, by process, or by people, there is a place for you in this field. This isn't just an industry for tech gurus or for clinicians. It's for the translators, the builders, the innovators, and the problem solvers who are passionate about building a healthier future for all of us. The digital transformation of healthcare is not a distant, future event. It is happening right now in every hospital, every clinic, and every lab across the country. And it is being led by people in roles just like these. Choosing a career in health informatics today is one of the smartest, most future-proof decisions you can make. You are not just stepping into a job market with incredible growth and stability. You are stepping onto the front lines of a revolution. You are becoming an architect of a system that is smarter, safer, and more human-centered than ever before. So, I want you to think about your own strengths, your own passions. Do you see yourself as the detail-oriented analyst finding the signal in the noise? As the data scientist building the predictive models of the future? As the implementation specialist guiding people through massive change? As the consultant solving the unsolvable problems? Or as the CMIO leading the entire charge from the very top? The path you choose will depend on your unique talents and ambitions. But know this: every single one of these roles is vital. Every single one offers a chance to do meaningful work that has a profound impact on human lives. I want to hear from you. Which of these 5 careers resonated with you the most? Were you surprised by our number 1 pick? Let me know in the comments below. I truly value your perspective, and I make a point to read through as many as I can. And if this video helped demystify the world of health informatics and gave you a clearer vision of the incredible opportunities waiting for you, the single best way to support this channel is to hit that like button. It tells the algorithm that this content is valuable, and it helps get this information out to more people who need to see it. For more deep dives into the most important and fastest growing careers shaping our world, make sure you subscribe and click that notification bell. You are building your future, and my goal is to give you the clearest possible map. Thank you for joining me on this journey. Now go out and build the future of health.